Now, the government is adamant that the COVID-19 vaccine is on its way, but critics are angry that a lot of more people and not more lives will be lost before it arrives. Well, overnight, the country recorded another 17,700 infections, the highest daily increase yet. 465 more people have died due to COVID-19. Mark Heywood, Maverick citizen editor and former health and human rights activist, joins me now for this conversation. Mr. Heywood, good to have you and good morning to you. I mean, South Africans, or at least the majority of them, not satisfied that it seems we'd only be probably getting the vaccine in the, first half at least, or the second half of this year. Well, the president's saying between 4 to 5 months or later 6 months. What are your thoughts on this update that it seems that we may not be getting this vaccine at least anytime soon?
Well, it's not good enough. As you said in your introduction, there are many people, many organizations now across South Africa who are expressing concern about these timeframes. I've heard concern from clinicians, from the South African Medical Association, from the Congress of South African Trade Unions, and from many, many civil society organizations. And I think it's for very good reason, because, again, as you mentioned in your introduction, this wave of COVID-19 infections is growing by the day. Our deaths is growing. And at the same time, we're beginning to see in particularly developed countries that several vaccines are now being rolled out in millions of doses to populations in those countries. But we, who are a severely affected country in South Africa, are told that if we're lucky, we will get some doses. We haven't been even told how many doses of a vaccine by late June. So that actually it's the end of the second quarter of 2020. So for good reason, people are saying to government, excuse me, can you not do better here? Can you not show more urgency? Can you not exert more power in your requests and your demands to pharmaceutical companies that have these vaccines, that they make them available in developing countries, including South Africa?
Yeah, where do you think government dropped the ball here? Because a lot of questions have been asked about where did the 500 billion rands go? What have you been doing in terms of preparing yourself for the vaccine, preparing yourself for making sure that PPE is sufficient in hospitals, for example, preparing yourselves as government for the second wave? Now the vaccine, hearing the news that it may not have even come in time, in as much as we're definitely one of the hardest hit. I think even with the second wave, the UK now saying that some of their cases have been detected from South Africa, hence the ban from travelling from South Africa to the UK, for instance. I mean, where do you think cabinet or even government dropped the ball?
Well, I think government would say that it didn't drop the ball, but most people now think that it did drop the ball on this. They set up a ministerial advisory committee on vaccines, I think back in August or September of this year. So there should have been recommendations before the government about how to prepare for a vaccine from as early as then. We've known throughout most of 2020 that vaccines were in development, and that at some point it's likely that vaccines would be approved for use. So I think that, it's just that there hasn't been sufficient of a sense of urgency around vaccine strategies, and I think government has been preoccupied on other fronts and just hasn't assigned the resources, the people, the thinking, the brain power, if you like, to develop a plan. But I also think that they should have done much more to consult people in the population, to consult the medical profession about what a vaccine plan should look like. Because a vaccine plan has to have several components. Firstly, obviously, there's the procurement of vaccines, which we're stuck, if you like, at step one. But once we've succeeded in procuring vaccines, we're going to need to have a plan to distribute them very, very quickly. We're going to have a plan that says who should be prioritized for vaccine access because of their higher risk. We're going to have a plan to make sure that people understand and are not afraid of a vaccine and come forward voluntarily to take vaccines. So it's an immense task, Tumelo. It's almost like what we faced with HIV 20 years ago when we commenced the antiretroviral rollout. We knew that we had 5 million people who needed access to those medicines, whose lives depended on access to those medicines, and we had to approach it with a sense of the greatest urgency.
All right, we'll leave it at that. Mark Heywood, Maverick citizen editor, thank you for your time.